For all health professionals, you may come across situations in which you wish to end your relationship with a patient. But how do you do this? And are there certain situations in which you are not able to end your relationship with a patient? Each college has policies and guidance in place that health professionals must follow before the relationship with the patient can be terminated. In this video, we'll be discussing the College of Physicians and Surgeons' policy regarding ending the physician-patient relationship. The College of Physicians and Surgeons' policy on ending the physician-patient relationship applies to all physicians, regardless of specialty or practice area, for situations in which the physician-patient relationship ends prior to reaching the normal or expected conclusion of the patient's care. The CPSO has identified a number of situations in which it may be appropriate to end the physician-patient relationship. These are: first, where there has been a significant breakdown in the physician-patient relationship. This may be a result of behavior which significantly disrupts the practice or other inappropriate forms of behavior, including abusive or threatening language. The question here is whether the mutual trust and respect between the physician and patient have been undermined, and if so, whether the relationship is beyond repair. Second, where the physician wishes to decrease their practice size. Third, where a patient has been absent from the practice for an extended period of time. Fourth, where a patient has refused to pay an outstanding fee. And fifth, where the patient has sought care outside of a rostered practice. There are also specific situations that the CPSO has identified as not being appropriate for ending the physician-patient relationship. These are, first, where you are prohibited from doing so by legislation, and second, where you are ending the physician-patient relationship solely because the patient does not follow advice, suffers from an addiction or dependence, or is on a high dose of a prescribed controlled drug and/or substance, or seeks treatment to which the physician objects on the basis of conscious or religious beliefs. If you have identified that your situation falls into a category in which it may be appropriate to end the physician-patient relationship, the first thing you must do is notify the patient of the decision to end the physician-patient relationship. The CPSO advises that you do this in person if it is safe and possible to do so. You should clearly communicate to the patient that they should seek ongoing care. You must provide your patient with a written letter explaining that you are ending the physician-patient relationship. The written letter can identify the reason for ending the relationship, if appropriate, and should provide the patient with resources for finding a new physician. Your obligations to the patient do not end once you provide them with the written notification, though. Physicians must ensure that they provide necessary medical services while the patient seeks a new physician. In fact, discontinuing professional services that are needed could constitute professional misconduct unless alternative services are arranged for the patient. This could include renewing the patient's prescriptions and ensuring that their laboratory and test results are ordered and followed up on appropriately. Physicians also have an obligation to be as helpful as possible to the patient in finding them a new physician or care provider, and to provide the patient with a reasonable amount of time for doing so. The CPSO does not require that you continue to provide care to the patient indefinitely, but care must be provided in an emergency, where the provision of care is necessary to prevent imminent harm. Physicians must also seek to accommodate patients with special needs or disabilities that may make seeking new care challenging. However, if the patient poses a genuine risk of harm to the physician's staff, or to other patients, then the physician is not under any obligation to engage with the patient prior to ending the relationship. If the physician-patient relationship is ending due to a physician's retirement, relocation, or a leave of absence, or if the relationship is discontinuing due to disciplinary action by the CPSO, then the physician has different obligations to keep in mind, which can be found on the college's website. Navigating ending your professional relationship with a patient can be tricky. If you find yourself in this situation and have any questions, our team at Rosen Sunshine is able to assist you in determining the best course of action for you to take.